Hi everyone, this is Nour, integrative and functional dietitian, and I help people with digestive disorders, digestive dysfunctions, and medical conditions related to the gut overcome these health issues. And today I want to talk about H-pylori because I see it often with my patients, and I want to share information about it with you today. Now, H-pylori, what it is. Before I keep going, if you have any questions about the things that I'm talking about, make sure that you leave me your questions in the comments. I'm going to try to get to them once I finish or as I am talking. And after I finish the live, I can come back and answer any of your questions. So if you can hear me okay, just say hi, let me know where you are or that you're listening, and we'll keep going. So H. pylori is referred to as Helicobacter pylori in some countries, and it is a bacteria that can grow in the stomach. Now, infection rates vary between 20 to 50% depending on country and geographical location, and in some countries up to 80%. Now, the bacteria has a helix-like shape, what makes it able to drill through and burrow through the lining of the stomach. And that's one of the reasons it can cause damage, is because it thins the lining of the stomach. So that can cause atrophy or damage and inflammation. And it makes the stomach sensitive to things that are naturally and normally are there, and we need them there, such as hydrochloric acid, digestive enzymes, and the gastric juices. So it can have a negative effect, and it definitely has a negative effect on how you feel and the rest of your body, and that's what I'm going to share today. So why is it important to address H. pylori? Because it thins out the lining of the gut, it can cause pain and irritation and inflammation. Obviously, that's not something pleasant or something you want to live with. And H. pylori can cause ulcers and gastritis. So again, the pain, the discomfort, the scarring in the stomach. And in certain cases, if the bacteria has developed or started to create certain toxins, it can increase the risk for stomach cancer. So obviously, that's not something we want to, hopefully we can avoid. Now, H. pylori also interferes with hydrochloric acid production, and that has a detrimental effect on digestion and the rest of the gut and your overall health. And that's what I want to take a couple of minutes to talk about, to give to really highlight how H. pylori through affecting HCl can cause stomach digestive upsets and other parts of the problems in the body. So stomach acid, or hydrochloric acid, sometimes referred to as or HCl, is produced by the cells that line the stomach, cells in the stomach. And it's really needed to activate the enzymes that break down proteins, specifically pepsinogen to pepsin. So without the step, it's that enzyme, pepsin, is the first enzyme that breaks down protein. So if we don't have that enzyme activated, we are going to have problems digesting protein, which also means that we're going to have problems absorbing amino acids, which we obviously need for so many functions in the body. So sometimes people with H. pylori, people with low hydrochloric acid, they would say they have a harder time digesting animal proteins like chicken and beef, and because they are higher in protein usually. Now, so number one is we are going to have problems digesting proteins and absorbing amino acids. The other problem with messing up the acidity in the stomach is that the acid is needed to be able to absorb vitamin B12, iron, zinc, selenium, and these minerals are better absorbed in the presence of acidity. So now you can have malnutrition or deficiencies in these nutrients. And so if you've heard that you are what you eat, I always remind people that you are what you digest and absorb, because if you're not absorbing the nutrients, the body's actually not benefiting from them. And then that could lead to like anemias, or even like your nail. You might notice your hair, your nail, your skin doesn't look as healthy and vibrant, and that could be nutrient deficiencies because of a problem in the digestion process. Now, the acidity is also important to trigger the rest of the digestive process. So think of digestion as a chain reaction, and if the first step gets messed up, or like maybe a domino, if you are trying to drop those domino pieces, if the first one doesn't trigger all of this sequence, then you're not going to have that effect and you're not going to benefit from all of digestion. So we really need the acidity as the food mixes up with the hydrochloric acid and the digestive enzymes in the stomach, and now it exits the stomach. It needs to be at a specific pH. It needs to be acidic. And this acidity is what is going to trigger a hormone, cholecystokinin and CCK in the duodenum, to go and send messages for the pancreas to produce its pancreatic enzymes or pancreatic juices, and it will also stimulate the gallbladder to release ox bile that are important for absorbing fats. And so when the signal is messed up and it's not coming out properly because what's leaving the stomach is not acidic enough, then we're going to have a problem in the rest of digestion, which also mean that you may experience bloating, gas production, pain, diarrhea, constipation. And that by itself can lead to bacterial overgrowth. Because if we have proteins and carbohydrates that escape normal digestion, then they make a great feast and food for bacteria. And so we possibly can see bacterial overgrowth in the small intestine, like SIBO, or even in the large intestine, because there are a lot of carbohydrates and protein escaping digestion and feeding the bacteria. Now, the other reason or why hydrochloric acid or the acidity in the stomach is important is because it keeps the stomach strong and sterile. We cannot live in a bubble, and you are going to get exposed to pathogens and parasites and bacteria from the environment, from food, water, lettuce, spinach, things that you can get contaminated with fecal matter. It happens. And so the stomach is acidic, and that the job of it is to kill anything that comes into your body. However, when it's not as acidic, then you can have potentially pathogens coming into the small intestine, staying in the small intestine, and causing even low-grade inflammation. You may not feel it as, now you may feel it as like a gastroenteritis and like flu, and not flu, like fever and stomach pain, vomiting, but you may have a low-grade infection that stays in your gut and doesn't really have those acute symptoms and can cause damage over time. So the H. pylori, what it does, it stops or reduces HCl production because it wants to survive the stomach. And that can have the detrimental effect on digestion and how you feel. Now, what are the symptoms of H. pylori? You may experience like a dull feeling, a dull pain feeling in the upper part of the abdomen. It may come and go. It may come when you're not eating anything. So that's one of the signs of an ulcer. You may experience acid reflux-like symptoms like burning in the chest. Sometimes maybe it can affect like LPR or when the acid travels to the throat. Now, part of it is that, H. pylori reduces acid production, but now that we don't have food being digested properly, that may cause the stomach content to reflux up, which can create the acid-like response in the throat, like hoarseness and sore throat, and trouble swallowing. You may experience bloating, burping, nausea and vomiting, indigestion or food feeling stuck in the upper part of the stomach like a rock, bad breath because the H. pylori. I have a friend who's a dentist who says she can tell from her patients the breath in their mouth if they have H. pylori or not. So that was an interesting comment. Loss of appetite or weight loss, and then you may also experience other non-digestive symptoms like mood swings, anxiety, joint and muscle pain, fatigue, because once you start having a problem with the gut, digestion, inflammation, it's going to have a systematic effect. So how is H. pylori detected? Now, there are several tests that can be used medically to diagnose H. pylori. It's important to test and not assume you have something. So just make sure that this video is for educational purposes, not for diagnosis purposes. There is a breath test where it measures the carbon dioxide production, and that if it's high, your doctor may tell you that you have H. pylori. There are stool testing for H. pylori, and I use a stool test. I'm going to tell you more about it. And there's also a blood antigen test. However, with blood, it's important to realize emphasize that if it's IgG blood was positive, that means you had it in the past, and an active H. pylori is an IgA or IgM result. So like interpreting the result with your doctor is really important. Now, stool testing has been the method that I use with my patients. I run a stool digestive health panel for all of my patients because I want to know if they have enough of the beneficial bacteria, any dysbiosis, if H. pylori is there, and now it's affecting digestion, absorption of nutrients, and what we need to do about it. But the reason I like the test, or what I love about the information I get, is that I'm going to show it up here on the screen, is that it gives me a quantitative number for H. pylori, not just whether it's there or not. And so this is a sample test, and this is telling me there's 2.9 e to the power 3. And this is a pretty high, like I don't have this very often, but a true positive if you have more than 1,000, and this person has definitely in the higher, here we go, 2,900 level. So what we know is definitely there. If you are running through your doctor a positive, negative kind of test, this would be definitely a positive. The importance of having, and I don't have a sample picture here, what if somebody has 800, so 8.1 e to the power 2? A typical test will tell you that you don't have it. A black or white, pass-fail kind of test will come back and tell the patient that you don't have it. But 800, 700, 600, 900, this is all significant H. pylori levels, and if that continues, you may go for years thinking that you don't have H. pylori when the numbers are creeping up. And so for me, really a lot of information comes in, even if this was present but not in the red range. So that's number one, quantitative is important. Number two is virulence factors, which is the ones presented here. Again, this is not typical for me to have 4 of those positive, but if they are positive, that means that there are certain compounds that the H. pylori is producing increases, and though they increase the risk for ulcers and stomach cancer, it just gives us the insight that it's actually pretty severe and has developed, so we definitely want to do something about it. The other piece of information, so this is how the test looks like for me. The other piece of information that I'm going to share now is the antibiotic resistance. Now, as a dietitian, I obviously don't use antibiotics or can't recommend or prescribe them, but if you are working with a physician and part of the treatment is antibiotics, you obviously don't want to be taking an antibiotic that the bacteria is resistant to. So in here, like the clarithromycin is positive, which means that if your doctor prescribes this antibiotic, you're actually not going to eradicate the bacteria because it has developed the resistance to it, and that's going to have even a further damaging effect on your overall antibiotic resistance. So this is really important piece of information that I find useful. Sometimes, what if my patients want to take this information and look for a medical treatment, having this handy is really, really important. So what do you do if you have H. pylori? Now, if you're watching the video and you don't know, maybe you have the symptoms, you suspect you have H. pylori, the first thing you need to do is to actually test. So don't make assumptions, and this video is not to self-diagnose. But let's just say somebody has a positive H. pylori, what's next? Now, doctors typically, if we're looking at medical treatment for H. pylori, it is triple therapy, which is a PPI, proton pump inhibitor, plus 2 antibiotics, or quadruple therapy, which is PPI or H2 blocker plus bismuth plus 2 antibiotics. So that is the medical route. Now, when I'm working with my patients, obviously if I find results like the ones I showed you, I highly advise and recommend that they go talk with their doctor, at least look at all of the options and what they need to be doing. Now, if the levels are low or like present but not severe, there are definitely things that we can do to reduce the levels of H. pylori. And some studies have found that certain things like mastic gum, like zinc carnosine, glutamine, can reduce the numbers and can also help build up the lining of the gut. And that by itself helps heal the gut and reduce the pain. And obviously we want to eventually eradicate the bacteria. Other things can be berberine, as I said, so mastic gum, zinc, carnosine, glutamine, berberine, and bismuth. Sometimes combination herbs that may include aloe vera, DGL, marshmallow root. Okra can also build the lining of the gut. If you like to eat okra, that slime or that you feel from the vegetable, it actually can improve the lining of the gut. So I do recommend incorporating it as part of your diet. Also, antioxidant foods, whether it's from supplement form, sometimes they are found in combination products, or just generally eating a very high antioxidant rich and anti-inflammatory rich diet. So again, like, be careful for the supplements. Obviously medications, you have to see a doctor. There are a lot of supplements on the market, but I highly recommend that you first make sure this is the problem, and then you work with someone who knows the dosing and how long you should take it for, because you shouldn't be taking these ingredients long term anyways. Now, diet and lifestyle tips for H. pylori, and these are diet and lifestyle tips for everyone because they are going to help you boost digestion. So one of the most important things, and often overlooked because it's really simple and we're always looking for the best amazing thing to do and forgetting that it is chewing your food thoroughly. Breaking down your food with your teeth is that physical, mechanical part is really going to help the enzymes do their job. What you do when you break down your food and with your teeth, with your really by swallowing it, not chunky, waiting until it's like baby food consistency, is you increase the surface area of the food as it arrives the stomach. So now the enzymes can hit it in a much more efficient way. So swallow your food 20 times, maybe 30 times. Make sure you're not like, obviously you have to eat slowly and slower to be able to chew your food thoroughly. So that's really important, not super shiny, but we have to do it. Now, water. I do recommend not drinking large amounts of water with meals because that can dilute digestive juices. I mean, you may have heard of this, but really also what water does, it's a pH of 7 plus minus, and your stomach juices need to be at 2. So the water being more basic than the stomach acid, it can affect the pH of the stomach and then can interfere with the enzymes working properly. So if you need to take medications or supplements, maybe 2 to 4 ounces, half a cup, as low as you can, and then try to get your water intake away from meals. If you have H. pylori, or if you have if food feels like a rock sits in your stomach, or you can't digest, you're burping a lot, you're bloated, maybe constipated, think of cooking your food. You do get a lot of benefit from cooked foods. Steaming, simmering with liquid is better than dry grilled food. It can be harder to digest. You need more saliva really to moisten it, whereas things that are already with liquid going to be easier to digest. Avoid a big, huge salad, even though it's really good for you. If you have H. pylori or problems with digestion, it's going to hurt. Or like large amounts of fiber. We do need fiber, but if you have problems with digestion, we need to fix that problem in order to be able to tolerate all the good fiber. And cook if you can't tolerate maybe a steak or a piece of grilled chicken, try to use them ground because ground chicken or ground beef can be a little bit easier to tolerate. And you do want to avoid processed foods, sugars, alcohol, things that are going to cause inflammation, because we really want the lining of the gut to heal. Now, a few other tips that I like to recommend or remind people that H. pylori can be transmitted through saliva, so mouth-to-mouth contact. So if you have it or your significant other has it, it is very likely that it's going to run, can be transmitted between the two of you. Also, it can run in families, so sharing utensils or with your child can be a problem as well too. Now, from what I've heard, you may be tempted to go and try hydrochloric acid because it is, you may think that, okay, well, I'm going to take hydrochloric acid because is going to help me digest better. However, if you have H. pylori, the hydrochloric acid is going to cause it to burrow deeper in the lining of the gut, which makes it harder to eradicate. So think of adding hydrochloric acid or digestive bitters or maybe raw apple cider vinegar. You may have heard that they're good for digestion, and they are, but if you have gastritis or ulcer or thinning of the lining of the gut or H. pylori, it's like trying to get a massage when you have sunburn. One of the doctors I follow uses this analogy, and it makes total sense. As much as you love a massage and it makes you feel good, if you have a sunburn, it will be the worst thing that you can do to your body now. So we have to allow some time for healing, building the lining of the gut, and then we can try incorporating hydrochloric acid. And also H. pylori, the last note is that it's a gram-negative bacteria, which means that it has an outer layer that contains endotoxins or things called lipoprotein saccharides, LPS. What these compounds are inflammatory. So as you are trying to eradicate the bacteria, whether it's by medication or supplements, you may actually experience die-off, which is more like a low-grade fever or fatigue or brain fog or headache. So it's going to be important, if you're going to use the supplements, to start slowly and to make sure that your digestive system, you're having regular bowel movements, you're detoxing properly, the liver works nicely, you're drinking enough fluids, you're having regular bowel movements, and peeing and pooping regularly is going to be really important. So this was a lot of information about H. pylori, and I hope you thought it was beneficial. If you have someone who may benefit from this information, who has these symptoms, make sure you share this video with them. And if you like this, and I'll be sharing more content like this, make sure you follow on Facebook and follow me. I'm also on Instagram. Also subscribe to YouTube, where I'll be posting also videos like this. Ask me any questions. I'll come back and answer them and I will talk to you, I guess, next time. Have a good one.